Hey everyone, Dr. Halliday here with LifeQuest Chiropractic and Sports. Today we're going to be continuing our mobility series, and today we're looking at the knee. The first video in this series, which covered the ankle, is posted on our website, and if you've not yet checked out that video, I would encourage you to do so. Alright, so the knee joint is comprised of two bones, the femur and the tibia, as well as a handful of supporting ligaments. There are two primary motions that occur at the knee, the first being knee extension, which is the ability to straighten out your leg. And the second is knee flexion, which is when you bring your heel towards your butt. Now, I see a lot of people in my office who have knee pain. Now, typically how it presents is they have pain on the front of their knee and they can't really point to exactly where it is. But it hurts when they bend, walk, and they go up and down stairs. Now, one common cause of this is a lack of knee flexion. And a lack of knee flexion is usually caused by a tight quadriceps muscle. Our quadriceps becomes tight when we're sedentary and we spend a lot of time sitting. Now, this tight quadriceps actually can alter the path that our kneecap travels. Now, this path is called patellar tracking, and a tight quadriceps can alter that tracking by either, instead of going straight up or down how a normal kneecap is supposed to go, that kneecap will drift to the left or to the right. And when it drifts, that causes excess irritation on the femur and on the kneecap itself, which both can result in pain. So if this sounds like you, we're going to go over an assessment to assess knee flexion and how to mobilize it and treat it. All right. To assess for knee flexion, first thing we're going to do is we're going to lay on the ground on our stomach. Now, for knee flexion, we need about 140 degrees. So how we assess it, while laying flat, all we're going to do is we're going to bring our heel towards our butt. Now, we should be able to get our heel towards our butt, and if we can't, that's a sign that there might be some limited flexion. While performing this test, one thing we want to keep in mind, and a way how we cheat, is a lot of times as we bring our heel towards our butt to get a little bit more, we tend to lift our hip off the ground. We want to avoid that. So keeping our hips flat on the ground, bring our knee towards our butt. If we can't reach our butt, it's probably a sign that we got some limited knee flexion. All right, so first thing we're going to do to help loosen up the quad and improve knee flexion is use a foam roller. Now, when we're foam rolling our quad, we're going to be laying on top of it. So while doing that, what I want to bring your attention to is we have two bony prominences. The first one is right here on the front of our hip, and the second one is our kneecap. When we're foam rolling, we want to stay in between those 2 points, because if we kind of roll on top of them, it doesn't really do anything and it provides discomfort. So when we foam roll our quad, we're going to start right at the top, right underneath that bony prominence, and we're going to kind of go hunting for some very tender points. And when you find one of those points, we're going to sit there and we're going to bring our knee towards our butt. We're going to do this until we kind of feel that spot loosen up. Then we're going to kind of keep hunting for more spots. Now, you may notice I'm turning my leg in and out, and you may notice you're going to have tender spots more towards the outside or the inside of your thigh. That's totally normal. If you notice that, just kind of turn the leg, find those spots, and work them out. Now again, when we foam roll, we only really need to do this for about 30 seconds to a minute to achieve the desired effect. All right, so after foam rolling, next we're going to proceed to stretching out the quadriceps. Best stretch for stretching out the quadriceps is called the couch stretch. The reason this is called this couch stretch is because this stretch is very easy to perform on a couch. So what we're going to do is we're going to imagine this is our couch, and what we're going to do is we're going to place our knee right at the base of the couch and our foot right on top of it. We're going to get our other leg kind of out in front just like this. Now, in order to stretch the quadricep and improve knee flexion, first thing we're going to do, we're going to bring our butt back until we reach contact with our heel. After we reach butt to heel, we're going to maintain that and slowly straighten up. Now, you should feel a nice stretch right along the front of your thigh here. And that's kind of what we're looking for. So as we're just going to kind of slowly keep working our way up to the top until we can get to completely vertical. Now, once we get to that point, instead of arching backwards, what I want you guys to focus on is squeezing our glutes to get this stretch a little deeper. So once we're standing up vertically, knee in contact with our butt, I want you to start squeezing your glutes, and that'll deepen this stretch even more. That squeezing of the glutes is going to cause a posterior shift of our pelvis, which in turn lengthens our quadricep muscles. So now while stretching, we want to do about 1 to 3 minutes on each leg to get the desired effect that we're looking for. Now, one thing I want to bring to mind that while performing this stretch, if you feel any pain on the top of your ankle right here, that usually means the implement you're using behind you is too tall. So if you do experience that pain on kind of the top of your ankle, find something a little lower to do on and try again. So that concludes our video on knee mobility, and I hope you guys enjoyed this video, and stay tuned for the next one.